Hello there. So I love to cruise, and I at one point was going to take a cruise nurse position. So let me tell you about it. I didn't take it because I had other obligations, but let me tell you about the process. So when I was applying for it, you had to have, I want to say for this particular contract, for this particular position, you needed 3 years of experience. And they really wanted critical care, like ICU, more so ER experience. And you had to have ACLS. And also with this position, they preferred if you had a BSN. You could still apply if you didn't have the BSN, but they really wanted you to have the critical care experience, which it makes sense because you'll see all types of patients who have fallen, patients who are seasick, someone may have had an allergic reaction. More serious, someone may have a stroke or heart attack, CHF exacerbation because they're eating all that food and not watching their intake. All kinds of things, like anything you would see in an emergency room, you could see here on a cruise ship. I would have treated crew and passengers. In that position, it is a contract. So I was applying through, I want to say it was like a third party company, and the contract was like a normal travel nurse contract. It was 12 weeks. It was going to be a 12-week contract. The pay, this was several years ago, but I want to say the pay would have been like $85,000 a year. So that meant if I would have taken several contracts in that year, I would have made like $85,000. But the good thing about being a cruise nurse, you don't have to pay rent. You don't have food expenses. The only expenses you have, if you have other obligations, personal items. But yeah, the room and board really was covered. And also, I would have been an officer, so I would have had some officer privileges. And the good thing is, I would have had a single cabin. Now, I may have been this big, but I would be in the cabin by myself. And the shifts, if I remember, I want to say it was 12 on. I think you rotated. I wouldn't have been the only RN. I think they said it would have. This was for a larger cruise ship. So I want to say there were 3 to 4 RNs and you rotated the schedule. I don't know. I can't remember if it was 12 hours or like you worked a full 24-hour shift where you would be scheduled in the clinic, but you would be on call for 24 hours. So let's say someone fell in the bathroom and they couldn't get up. So you, as the RN, will come and assess that patient and call for backup if you have to take that person to the medical center. And also, you work with doctors. If someone had to be evacuated from the ship, that's the doctor's call. But you as a nurse would treat that patient until they move on to the next level of care. Whether that person is medevaced off the ship or they are taken off the ship at the next port and go and be admitted to the local hospital at that port. So another thing, always, when you travel, especially cruise, get a travel insurance policy with a medical plan, because you never know. You may feel okay going on the ship, but you never know what'll happen. And you don't want to be stuck with those bills. Like to be medevaced off of a cruise ship in the middle of the ocean, you can only imagine how much that's going to cost. So that's why get the travel insurance. As a matter of fact, I actually have 2 policies for this cruise because I booked with a travel agent, and then I ended up getting another one that's slightly different. The extra $100 for both the policies. I'd rather pay that than pay $30,000 to get evacuated off this ship. God forbid something happen. I don't think anything's going to happen to me, but you never know. So yeah, Yeah, the contract was 3 months. The good thing, so, since you were an officer, you could go, like on your off days, you could disembark the ship and go to ports and do whatever, come back. Yeah, so it seemed like it was going to be a really cool gig. But like I said, I had other obligations, so I wasn't able to be gone for that amount of time. But if I didn't have those obligations, I would have taken it. I think it would have been wonderful. A wonderful experience, because like I said, I love to cruise, and why not work and get paid to cruise? So why not? So yeah, if you have the opportunity, you have the critical care experience, you have your ACLS, you like to travel, you want to see the world, consider cruise ship nursing.